So this is the keyword for Guichitang. Guichitang, yes, all these formulas. Guichitang, Sanchuin. I told you, repeat, follow me. Loud, Sanchuin, Incheosan, Chaigejejitang, Rensenbaidusan. These 5 of them are releasing exterior formulas. So this formula is given with a hint like a treating common cold or respiratory problems. And Guijitang's keyword is sweating. If the question clearly addresses the patient has a spontaneous sweating, just natural sweating, Guijitang can be the right answer. And this ratio can be asked. So right before examination, memorize this. It was there, so it has way higher chance to be there again. And Sanchuin and Incheosan is a vamping formula. So wind heat. And Guijitang is wind cold. And what is the specific sign of wind heat? Keyword, sore throat. Sore throat is the keyword. But take a look at this. Sanchuin has a Ju. This is Juhua. Juhua. Remember what is Juhua? Juhua is chrysanthemum. Now connect the dots. And chrysanthemum treat liver yang raising. So it treats headache and eye symptoms. So beside these wind heat symptoms, respiratory common cold, sore throat, Sanchuin treat eye symptoms. So compared to Guijitang and this wind heat formula, these 2 formulas are used for more fever than chills. So this can be a keyword too. Fever than chills. Probably for the Guijitang, chills more than fevers. So that may be given in your examination. And you need to compare ticklish throat. This is sore throat and this is ticklish throat. Not throat pain, but ticklish and coughing. This is a wind dry. Like a Singsusan. The Guijitang wind cold and Sanchuin Incheosan wind heat. And Chaigejejitang specifically for headache. So headache is the keyword. Headache. And orbital pain. So underline this. So Chaigejejitang, headache, and headache can be given as a hint likewise. TMJ pain and toothache and trigeminal neuralgia. So consider these things as a part of headache. And memorize the different channels in your head. Likewise, Baichi and Gugun and Chaihu. Gugun treat the Yangming headache, and Chaihu, Shaoyang headache, and Baichi, Taiyang headache, and Rensenbaidusan, weakness, Qi deficiency. This is the keyword. So all these formulas, 5 formulas, share the common cold. But Guijitang, wind cold, and Sanchuin, Incheosan, wind heat, and Chaigejitang, headache, and Rensenbaidusan, Qi deficiency. And what if the Rensenbaidusan that cannot treat the exterior symptoms very well? It can be your modification question. Then add Jingje Fangfeng. Jingje Fangfeng. And if there's a severe sore throat and inflammation, add Jininhua and Lin Chao. So when you think about these formulas, remember this Man, Pi, Shi, Zhao. And you don't have to differentiate this Qi, the Pi, and Man. So they are practically the same thing, the distension, the gastrointestinal problems. Hopo Jishi, Hopo Jishi. And Da Cheng Ching Tang treat those abdominal pain, the discomfort, and excess stool, the palpable stool. This is Shi. And Mang Xiao treat Zhao, dryness. So this is a bulky, sausage-like stools. And this Mang Xiao treat the dry stools. So Da Cheng Ching Tang treat all 4 of them. And this can be on your examination, likewise giving you patient has dry stool and excess mass of the stool and abdominal distension, which formula you need to choose. Then Da Cheng Ching Tang is the right answer. And Xiao Cheng Ching Tang does not have Zhao. Okay? Xiao Cheng Ching Tang does not have Zhao. No dry stool. So if the question give you with a dry stool, xiao chengji tang is not an option. So you can exclude right away. And tiao wei chengji tang does not have manshi. So let's say this is easier. Oh, yeah. Without dry stool. That is xiao chengji tang. And tiao wei chengji tang without GI discomfort, like distension or epigastric, the heavy stagnation. So no those symptoms. So only Shi, Dawang, and Mangshao and Ganchao. This is a composition. Only 3. Ganchao, Dawang, Mangshao. So no abdominal discomfort, but irritability. Tiawei Chengjin Tang. Runchawan does not have Mawang. Remember, if the question asks you which formula does not have Mawang, only formula in this category without Mawang is Runchawan. So this is kind of lubricant. Lubricate. Just lubricate. No Dawang. Remember this. And Machiren 1 is Xiao Chengji Tang. CGT is Chengji Tang. Xiao Chengji Tang with Machiren. So this formula has Dawang. That means this formula is for heat and excess with Dawang. But Machiren is a king herb and Machiren lubricate. So lubricate, nourish in. So this is elderly patient. So constitutionally they have a dryness, and Machiren nourish those dryness, but those elderly patients occasionally have a trouble with the heat type of constipation. Then Machiren 1 can treat those symptoms. So these are category 2 drain downward formulas. So Shaoyang and Yangming organ formulas. And now this Xiao Chai Hu Tang, Si Ni San, and Xiao Yao San, and Ban Sha Xie Xin Tang. These are Shaoyang formulas. So Xiao Chai Hu Tang composed of Chai Hu and Huang Qin. Chai Hu and Huang Qin. And Ban Sha Ren Shen. Ban Sha Ren Shen. When you find a Ban Sha Ren Shen, think about Xiao Chai Hu Tang and Ban Sha Xie Xin Tang. So Xiao Chai Hu Tang and Ban Sha Xie Xin Tang is almost siblings. Identical, except Xiao Chai Hu Tang has Chai Hu and Ban Sha Xie Xin Tang has Huang Nian. This is the only difference. Huang Nian and Chai Hu. Huang Nian and Chai Hu. That is the only difference. Chai Hu and Huang Nian. So Xiao Chai Hu Tang is used for Shaoyang symptoms. Shaoyang. What is Shaoyang symptoms? Alternating fever and chills. So these will be given as a hint for your examination. Alternating fever and chills. And bitter taste and dry throat. This is Shaoyang, liver and gallbladder, side of your body. So hypochondriac pain, those Shaoyang symptoms. And do not be confused with sour taste. In 5 element, wood belongs to sour, but Shaoyang symptom is not sour, but bitter taste. This is Xiao Chai Hu Tang. Clinical perspective, Xiao Chai Hu Tang is very commonly used for fever and gastrointestinal symptoms. So Chai Hu Huang Qin treat the fever, and Ban Sha Ren Shen treat middle jiao. So any kind of fever, hepatitis, or gastritis, nephritis, any kind of visceral infection, if it is mild, in Japan and Korea, we commonly use Xiao Chai Hu Tang. So most commonly used herb for fever with gastrointestinal symptoms like nausea, vomiting, and diarrhea. And Ban Sha Xie Xin Tang only treat this one. This is the keyword, peace syndrome. Memorize this, peace syndrome. What is the characteristic of peace syndrome? Do you remember? Am I too fast or too difficult? Please let me know. I'm too fast. Peace syndrome is epigastric discomfort with no pain. So remember this. This is Ban Sha Xie Xin Tang. And these are the keyword too. vomit and nausea. Especially vomit, once you eat something, you vomit it. Because Bansha Sheshintang treat the stagnation in middle jaw. So something stuck in your middle jaw. There is a Bansha Sheshintang. So Bansha Sheshintang is the most commonly used formula in Korea for gastritis or GERD and among pharmacists. Not acupuncturists, but pharmacists. The biomedicinal pharmacist. In Korea, biomedicinal pharmacists commonly prescribe herbal formulas too, and this is the most popular formula, Bansha Sheshintang. So Xiao Chayotang and Bansha Sheshintang is almost identical. Only one herb is different. Chaihu and Huangyan. And Sini-san. Sini. What is Sini? Sini means four extremity reverse. What is that? What does that mean? Four extremity reverse. That means qi does not reach to the end of your hands and feet. That means you have cold hand and feet. So Sini-san treat cold hand and feet. So we have two different Sini-san, Sini-tang, Sini, among CALE formulas. One is Sini-san and another is Sini-tang. Here Sini-tang and Sini-san. Sini-san is for liver qi stagnation. Liver qi stagnation. And this Sini-tang is severe yang deficiency. So there are two different pathomechanisms behind your cold hand and feet. Have you ever experienced cold hand and feet when you faced a severe job interview? So you're getting nervous and you have cold hand and feet. That is a stress, sympathetic nerve stimulation. Then you have a cold hand and feet. There is qi stagnation with the stress, liver qi stagnation. In those cases, Sini-san treat. So when your patient is so nervous and the gastrointestinal problems, a lot of stress and cold hand and feet, try Sini-san. But if the patient has general coldness, very sensitive to cold, Sini-tang, because this is a yang tonifier. Okay, you should tell the difference between Sini-san and Sini-tang. I tell you, Sini-san is for liver qi stagnation. Sini-tang is for yang deficiency. Okay, Sini-san and Sini-tang. Sini-san, S. What does that mean? Stagnation. Stagnation. Stag. Okay, Sini-san. And Sini-tang, this is yang deficiency. See? Yang. And Shaoyang is another formula for liver qi stagnation. But this formula treat liver spleen disharmony. Liver spleen disharmony. So Chaihu Bai Shao with Sujunjitang. This is Shaoyang. So when you get stressed, your gastrointestinal system, spleen, is damaged because wood damage the spleen. And Shaoyang treat those wood damaged spleen. And these are third category. So first, Baihutang. Baihutang treat stomach heat. So Shigao Jimu is the main ingredient. When you get the Baihutang in the examination, they will give you this as a hint. Big 4 signs. This is one of the most commonly shown hint and the commonly shown exam in CALE and national. Big 4 signs. I don't know why they keep on giving this question again and again. Fever, sweating, thirst, and big purse. Big means big purse. And this is a modification question. What if the patient has a severe thirst? Then add Rensen. And then my question might give you this weakness too. Weak and thirst. Then pick the Rensen as a modification. It goes stomach. And what? Qingwei-san. This one so goes to stomach. But this Qingwei-san, wei is stomach. Wei is stomach, like a Pi-wei-lun. Ping-wei-san, Qingwei-san. Do you remember Qingwei-san, Ping-wei-san? Qingwei-san goes to stomach. But this formula has shengma. Shengma. It is a guiding herb. Shengma is a guiding herb to upward. So if this one treat, Qingwei-san treat gum and tooth. These are the keyword, gum and tooth. Not like Pingwei-san. So never confuse Pingwei-san or Qingwei-san. So it treat gum disease because Yangming channel goes to tooth. And compare with Chaigejitang because Chaigejitang can treat gum and tooth pain too. And Daochi-san treat hard hit. And in terms of Daochi-san, you should remember this pathomechanism. Daochi-san treat small intestine hit by urination, by promoting urination. So what is the keyword? Dark urine is the keyword. Dark urine. And tongue ulcer. Ulcer in a tongue. Why? Tongue is where heart symptom presented. Heart and tongue. Connect these two dots. Tongue, urine, and heart. Irritability. So a lot. Dark urine, small intestine. Irritability, mental problems, heart. And tongue ulcer is also heart. That is Daochi-san. And Qi means, Qi here, Qi means red. So Qi Xiao means red Xiao. Bai Xiao, Qi Xiao. So Qi means red, and red consists to heart. So Daochi-san treat the heart. Wei is stomach. And Longdan Shegan Tang, Dan. Dan is gallbladder. But Longdan is the name of the plant, herb. Shegan. She means clear. Gan is liver. So it treats liver. And there are a few formulas treat liver channel. And this is one of them. Treat groin channel, genitalia, and damp heat. Damp heat. Because it goes to liver, it treat damp heat in liver, so jaundice and hypochondriac pain. And this can be given as a hint. So Longdan Shegantang treat liver organ, liver and gallbladder organ, so jaundice and hypochondriac pain. And also it treat liver channel, groin. Sometimes the breast can be given. Breast belongs to liver channel. And you need to compare this formula with Wan Dai Tang. Wan Dai Tang treat vaginal discharge. And Longdan Shegan Tang also treat genitalia problems. So it treats the discharge. But there's a difference because Longdan Shegan Tang treat heat. So yellow discharge, yellow, foul smell. But Wan Dai Tang treat white discharge. There is a difference. So you can find these two, Longdan Shegan Tang and Wan Dai Tang, in the same question as an option to pick the right answer, right? To pick the right answer. So if the question give you white discharge, pick Wan Dai Tang. If the question give you yellow discharge with foul smelling, pick Longdan Shegan Tang. So vaginal discharge can be Wan Dai Tang or Longdan Shegan Tang, either of them. So Wan Dai Tang is for spleen deficiency. So this formula actually binds those leakage, remove dampness, and tonify spleen. That is Wan Dai Tang. Dai means discharge. So compare with Longdan Shegan Tang. And Bai To Weng Tang treat large intestine, dysentery. Dysentery, especially bloody one. So if you find bloody diarrhea, think about Wan Dai Tang. And tenesmus. If there's tenesmus severe, which herb you need to add? This is a modification question. This is modification question. 무샹 빈랑. And this formula, if it is connected to Sanghanun, Juein formula. This belongs to Juein formula in Sanghanun. These organ hit formulas. Qingwei-san treat stomach, gum disease, toothache. Daoqi-san treat heart by promoting urination. It treats dark urine and tongue ulcer, insomnia, irritability. So I use this Daoqi-san with a lot of kids because many kids troubled with ulcer in their mouth and irritability and dark urine. And Longdan Shegantang treat organ, liver as an organ, so jaundice and damp heat, and also groin area like genitalia and the skin disease. So Longdan Shegantang is commonly used for skin problems too, especially if it belongs to liver channel. And Baitowengtang, Juein, and also treat dysentery, bloody type of dysentery. That is Baitowengtang. And next, these two formulas are very similar. Hwangnyun Jeju-tang, both of them treat heat toxin in 3 jiao. So both of them treat 3 jiao, upper, middle, lower. But Xie Xin Tang has Da Huang, so it treats the constipation. That is the difference between these two formulas. And Bai Hu Tang, just like Qingwei-san, treat the stomach, chi level. So I told you, remember 4 big signs. And let's talk about empty heat formulas. So Qinghao Biji Tang. Qinghao, when you hear the Qinghao, connects the dot with AIDS and malaria. These are the keywords were given as a hint in previous examination, and also these are the keyword too. Feeling coolness in the morning. So this is indeficiency heat. Qinghao Biji Tang treat indeficiency heat. Qinghao Biji Tang treat indeficiency heat. So repeat again and again. Qinghao Biji Tang. Do you know what is Biji? What is Qinghao? Qinghao is artemisinic acid. So Dr. Tuyu got the Nobel Prize from Qinghao. So there is a reason people connect Qinghao with malaria and AIDS, because they have constant latent fever. So Qinghao Biji Tang treat those latent fever. Then what is the characteristic of latent fever? Because it is indeficiency heat fever, worsen at night, afternoon, there is a common. But colds in the morning, this is a unique point. Colds in the morning. So remember this one for Qinghao Biji Tang. So if you find this, I think 90% Qinghao Biji Tang is the right answer. If you can find this coolness in the morning. Coolness in the morning. And Dangui Liu Huang Tang, also empty heat, but this one specifically treat night sweating. This is for hyperhidrosis. Dangui Liu Huang Tang. Liu Huang. Su Di Huang, Sheng Di Huang, Dangui, and Huang Qi. And Huang Qi is the largest dose. But Huang Qi is not a king herb. What is the king herb? Dangui is the king herb. Dangui and Su Di, Sheng Di is the king herb. But Huang Qi is the largest dose. So this can be on your examination. And even though this formula treats empty heat, so indeficiency basically, but Huang Qi is one of the ingredients to stop sweating. And if you want to use this formula for spontaneous sweating, add Baijiu and Rensen. This is a modification question. So in case of qi deficiency, add Baijiu and Rensen. Straightforward. It makes sense, Baijiu and Rensen. Then it can treat night sweating and also qi deficiency sweating, like spontaneous sweating. So take a look at this. These are clearing heat formulas. Clearing heat formulas, damp, deficiency heat, Qinghao Biji Tang, and Dangui Liu Huang Tang. And next formula, warm interior formulas. Warm interior. So we talked about sini tang. I told you sini tang. Tang connect yang. So sini yang. So sini tang, sini yang is for yang deficiency. Sini san, sini san connect san with stagnation. So sini san treat stagnation. What is the common denominator? Cold hand and feet. But sini san treat stagnation, san. And tang, yang, sini tang treat cold hand and feet with a yang deficiency. And let's talk about these four formulas: Li Zhongwan, Wu Zhu Tang, Xiao Jian Zhong Tang, and Da Jian Zhong Tang. Here you go. These are the formulas. So Li Zhongwan is from Sijunji Tang. Can you find? Sijunji Tang is a represent formula of tonifying spleen deficiency, qi deficiency. Sijunji Tang composed of Renzen, Baichu, Fuling, Ganzhao. Renzen, Baichu, Fuling, Ganzhao. This is Sijunji Tang. If you remove Fuling here and add Ganzhang, that is Li Zhongwan. Why? Because patient troubled with yang deficiency. Ganzhang warms middle jaw. There is a reason from Sijunji Tang, remove Fuling, add Ganzhang. So this is for spleen yang deficiency diarrhea. So remember this as a keyword. Tai in diarrhea, not Tai yang. Tai in diarrhea is a keyword. So this formula is commonly used for diarrhea with the coldness, because it treats yang deficiency. That is Li Zhongwan. What if the yang deficiency is severe? Modification question, add Fuji. That is Fuji Li Zhongwan. So Fuji Li Zhongwan composed of Renzen, Baichu, Ganzhang, Ganzhao with Fuji. And if you remove Renzen and Baichu, Ganzhang, Ganzhao, Fuji, there is Sinitang. This is Sinitang. So Ganzhang, Ganzhao, Fuji, this is Sinitang. Sinitang does not specifically treat spleen, but it treats general yang, especially kidney. There is Sinitang. So severe yang deficiency. But this Li Zhongwan specifically spleen, because Renzen Baichu, Ganzhang, Ganzhao. With Fuji, eat Li Zhongwan. And if you make this a decoction, that is called Renzentang. This is another name of Li Zhongtang. And Wu Zhu Tang treat vomit, vertigo, migraine due to coldness. So remember this one as a keyword. So remember this way: vomit and headache due to coldness. This is Uchuyutang. So vomit and nausea with a severe coldness in the middle jaw. The Uchuyutang. And Uchuyutang is most commonly used formula for migraine with the coldness. So this formula is specifically commonly used in Japan by medical doctors to treat migraine. In Korea, for the migraine, this is the most famous formula: Bansha, Baichu, Tianmatang. So when you have a migraine patient, you can pick one of those two, 50-50 chance. Bansha, Baichu, Tianmatang treat phlegm. So this formula treat headache and also gastrointestinal symptoms. So Bansha, Baichu, Tianmatang. So Bansha treat phlegm, Baichu treat stomach, spleen. Tianma treat headache. Tianma. This is a very unique and effective herb for headache. Bansha, Baichu, Tianmatang. So Uchuyutang treat headache and nausea by coldness. Bansha, Baichu, Tianmatang treat headache and nausea by phlegm. Same symptoms, but different cause. So when you find out Banja Baiju Tianma Tang, patient should have what kind of pulse? Slippery pulse. Wuju Tang, tight or slow pulse for cold condition. And Shaojianzhong Tang is based on Guiji Tang. If you add Yi Tang, maltose, in Guiji Tang, there is Shaojianzhong Tang. What does Guiji Tang do? Guiji Tang warms your belly and release the tightness with Shaoyao. So in Shaojianzhong Tang, this can be given as a question. Guji and Shaoyao ratio. So Shaoyao is doubled up to treat spasmodic pain. Spasm. That is what Bai Shao treat. So Shaojianzhong Tang is very commonly used formula. And what if you combine this Shaojianzhong Tang and Li Zhongwan? That is called. This is a modification question. Xian Li Tang. That's Li Zhongwan plus Shaojianzhong Tang. There is Jian Li Tang. This is also commonly used formula for kid. And Da Jianzhong Tang is a second commonly used herb in Japan among all other formulas. So really popular formula in Japan, but specifically this formula is used after surgery, open abdomen surgery, to prevent ileus. But not in United States, not in China. That is the unique phenomenon in Japan based on evidence. So they researched it and they found out that this Dachan Tang prevent those ileus after the surgery. Why? Because surgery, what is that? Excess cold. So this Dachan Tang treat excess coldness. So it treat yang deficiency but also excess coldness too. So both of them. Dachan Tang can treat excess cold. So it can treat tight pulse. Here, tight pulse. What is tight pulse? Excess coldness. So there are not many formulas which can treat excess cold. Dachan Tang is one of them. But Dachan Tang also can treat yang deficiency too. And the king herb is huaqiao. This is Sichuan pepper. Sichuan is the province in China. And sinitang, ganzhang, fuji, ganzhao. Severe yang deficiency, cold hand and feet. Cold hands. This is sinitang. And sijunjitang, please memorize all the ingredients. Renzen, baichu, ban, fuling, ganzhao. And shenning baichu-san, treat diarrhea. And we learned some formulas treat the diarrhea compared to Li Zhongwan. Li Zhongwan treat diarrhea with the spleen yang deficiency. And Buzhong Ichi Tang is another variation from Sijunji Tang. SJG means Sijunji Tang. So Renzen Baichu Fuling Ganchao. Renzen Baichu Fuling Ganchao, Shanyao is added. Shanyao is Nagaimo. So it tonifies the kidney and stomach, spleen, kidney and spleen. And Buzhong Ichi Tang, another variation from Sijunji Tang with Huangqi. So Huangqi, Shengma, this is the keyword, prolapse. So when you find out organ prolapse, Buzhong Ichi Tang is the right answer. But you need to double check with the pulse, tongue and pulse. And Buzhong Ichi Tang, inside the Buzhong Ichi Tang, there are herbs which guide the herbs upward. That is Chengma and Chaihu. So Chengma and Chaihu guide herbs upward. And Chaihu treat Qi deficiency heat. So Buzhong Ichi Tang treat Qi deficiency heat too. Let's say Qi deficiency heat. What is the characteristic of Qi deficiency heat? Worsen in the morning. And also heat sensation only on skin. Heat only skin. And worsen with the exertion. These are the characteristics of Qi deficiency heat, fever. And Yu Ping Feng San is the formula consolidating Wei Qi. So by putting windscreen, you prevent extra pathogen comes in. So Yuping Fengsan treat frequent common cold by increasing Wei Qi. But also you install the screen so your side of friends cannot go out. That is the reason how Yuping Fengsan treat sweating. So Yuping Fengsan treat sweating and also frequent common cold. It treat cold. Common cold. So this is spontaneous sweating and common cold, all related to Wei Qi. So these are the keywords for Yuping Fengsan. And why Fang Peng is here? Of course, it can release exterior, but also it lead the Huang Qi, action of Huang Qi to the skin. Sheng Mai San. Okay, here you go. Sheng Mai San. Rensen and Mai Mendong. There are formulas with the Rensen and Mai Mendong. And Rensen and Bansha. When Rensen and Bansha is combined, either of them, Xiao Chai Hu Tang or Bansha Xie Shen Tang. So treat the middle jaw. Rensen and Bansha. Rensen and Bansha. And when Renshen and Mai Mendong is combined, tonifies Qi and also tonifies Qi and nourish in and fluid. So it is good for summer because it compensates excess sweating. Summertime. So Mai Mendong and Renshen both nourish, add fluid. So it tonifies Qi and in both of them. Qi and in deficiency. And summer is a keyword. I think among 83 formulas, especially for summer, I think this is the only formula, Sheng Mai San. In national formula, there's Qing Chao Ju Fei Tang. So it also treats coughing because beside Rensen and Mai Mendong, it has Wu Wei Qi. So it treats summer, excessive sweating, summer. And Rensen and Mai Mendong, both of them generate fluid. Okay, let's Rensen, Mai Dong. We commonly just say Mai Dong. And Wu Wei Ji hold down the Qi. So Wu Wei Ji stop sweating and also stop coughing. So Sheng Mai San can treat coughing. So it looks kind of out of nowhere, coughing, but it treats coughing. And you need to compare this formula also with Mai Mendong Tang. Mai Mendong Tang has Rensen and Mai Mendong too. Let's see Mai Mendong Tang. So Mai Mendong Tang is Rensen plus Mai Dong and Bansha this time. Sheng Mai San, compare CF Sheng Mai San and Wu Wei Ji. What do they have in common? Rensen Mai Dong is a common between Mai Mendong Tang and Sheng Mai San. Sheng Mai San. So they both nourish, but Mai Mendong Tang with Bansha specifically treat coughing, especially dry coughing with hard to expectorate phlegm. And Sheng Mai San treat coughing, but that is not the main primary goal. Sheng Mai San nourish and tonify in summertime. Summertime is the keyword for Sheng Mai San. Sejunji Tang, Shenning Bai Chusan, Buzhongyi Tang, Yuping Feng San, Sheng Mai San. Sejunji Tang, general spleen qi deficiency. Shenning Bai Chusan, diarrhea with the dampness and spleen and kidney deficiency. So Shenning Bai Chu, this is Sejunji Tang. Can you see? Rensen, Fuling, Bai Chu, Gan Chao. This is Sejunji Tang. So Xuanling Baijusan is based on Sijunjitang. Sijunjitang with Sanyao. And Iren, Baipiandu, those removing damaged herbs. And Puchongjitang, Huangqi, it is also based on Sijunjitang. From Sijunjitang, which one is removed? Guess. If you understand the formulas, you can guess right, because Fuling has a downward action. But Puchongjitang is for upward action. So remove Fuling. Instead of Fuling, added Shengma and Chaihu to raise Qi. That is Puchongjitang. And Taisan Panshitang, that is for ferrous, calming ferrous. And this is based on Sijunjitang also, but again without Fuling, because Fuling can downward Qi. Then ferrous can be affected, those downward Qi. That is the reason you remove Fuling even though you want to tonify Qi when you calm ferrous. And same thing, Puchongjitang is for upward. So remove Fuling. And Yuping Feng San for sweating and low immune system. What does that mean in terms of TCM? Weak Wei Qi. Yuping Feng San is additional barricade for your Wei Qi. That is Yuping Feng San. So you install the barricade. So zombies cannot go in, but also you cannot go out. That is the problem. So you cannot go out, so you can treat hypohidrosis, sweating. And zombies cannot come in, so you can treat frequent common cold by strengthen Wei Qi. That is what Yuping Feng San does. And Sheng Mai San is for excess sweating and indeficiency and Qi deficiency when summertime. Those connotations, summertime and exertion, pick the Sheng Mai San. That is for Qi deficiency. First of all, you should remember all those variations from Liu Wei Diwan, very commonly shown on examination. And this is Liu Wei Diwan 1, and this side tonifies, blue side tonifies, and green side sedates. And Su Diwan tonifies blood in kidney, and Shan Yao tonifies kidney and spleen. San Chuyu tonifies kidney and liver. So Su Diwan, Shan Yao, San Chuyu. How about this? Mudan Pif, Jeshe, Fuling. Think about it. What if you have a patient who is extremely weak, deficient? Are you comfortable with using these three herbs? These herbs? No. So when you prescribe this Liu Wei Diwan Tang for extremely weak person, then you don't need this formula. This is not for... Okay, here you go. You remove all this sedating part. Sedating part, then there is Jogi one. Very simple and very reasonable. So what is the difference between Liu Wei Diwan 1 and Jogi 1? Removing sedating part and added gochiji. And gochiji and sanchuyu, those are paired herb. When gochiji and sanchuyu are combined, it tonifies liver strongly, liver and kidney. Gochiji and sanchuyu, and tastes so good too. So this is a very deficient, weak person. So they, practitioner, remove this part. This is Jogi 1. So Jogi 1. Jogi 1 and Zhang Jebin made this formula to treat elderly patient. Elderly patient. There is a reason he added tonifying yang herbs like Dihon, Lujiao, and Tushiji, and Guipan to clear empty heat. So you don't have to memorize this. Just remember, Jogi 1 is Liu Wei Diwan 1's variation without sedating herbs, and even with a little bit of tonifying yang herbs. That is Jogi 1. And how about the Yogi 1? What if you add Fuji Rogui into Liu Wei Diwan 1? It tonifies yin, but also tonifies yang. That is Shen Qi-wan. Sometimes we call this Bai Wei Di Wang Wan. Ba Wei Di Wang Wan. That means 8 flavor Di Wang Wan, because 2 are added. Bai Wei Di Wang Wan. And this formula tonifies kidney yang. Then Yogi Wan is simple. This is Shen Qi-wan. This is Shen Qi-wan. But you're afraid of sedating too much to remove this part. Same Guqiji and same yang tonifier like Diehon and Tushiji. That is Yogi Wan. So they are all connected. Yogi Wan and Jogi Wan and Liu Wei Diwan Wan and Shen Qi Wan. Okay, let's summarize it. First, Liu Wei Diwan Wan. First, Liu Wei Diwan Wan. If you remove the sedating part and add Guqiji, that is Jogi Wan. And this is Liu Wei Diwan Wan. If you add Fuji Rogui, that is Shen Qi Wan. If you remove from Shen Qi Wan the sedating part and add Guqiji and tonifying yang herbs, that is Yogi Wan. So Liu Wei Diwan Wan, this is Liu Wei Diwan Wan. When you remove sedating herbs like this, then add tonifying yang herb, that is Jogi Wan. From Ba Wei Diwan Wan, remove sedating herbs and add tonifying yang herb, that is Yogi Wan. So the middle part, you don't need this. This is for national, because there is a Jogi in, Yogi in for national. And also you need to remember all those modifications. What if you add Guqiji and Juhua? I told you Juhua is for what? Headache, liver yang raising. So patient shows any liver yang symptoms like blood visions and eye disorders with liver kidney deficiency, low back pain, tinnitus, weak libido, then this Jichu D11. Jichu D11. And if the patient has empty fire, severe empty fire, then Ji by D11. Ji by D11. Ji by D11. If you substitute all these 5 of them with Guipan, there is Dabu in 1. Great tonifying in 1. So Dabu in 1 and Ji by D11 is really similar. Dabu in 1. Dabu in 1. Is that your formula? I don't think so. Just forget it. That is only for national. I'm sorry. Okay, then Duchiwan is for OAG. So when the patient cough, what kind of herb need to be modified? OAG. What if you add one more? Mai Mendong. There's Mai Wei Diong one. And also OAG. And what if you add Shi Changpu and Ji Shi? There is Along Chuachi one. This is for deafness and tinnitus, severe tinnitus and deafness and loss of hearing. Shi Changpu and Ji Shi. Hearing loss. Shi Changpu, Ji Shi. Severe empty heat. Jimu Wang Bai. Eye symptoms, liver yang raising, Guqiji and Juhua. And there can be many other modification questions, Liu Wei Diwan Wan. So make sure to check the Bensky. There you go. So we finished all this in tonifier, Liu Wei Diwan Wan and Liu Wei Diwan Wan's friends. All the friends, you need to memorize them. And Jogi Wan, what is that? From Liu Wei Diwan Wan, remove sedating part. And Yang tonifiers. And Shen Qi Wan is Liu Wei Diwan Wan with Rogui and Fuji. Yugi Wan from Shen Qi Wan, same thing. Remove sedating part. That is Yugi Wan. And what is Bai He Gu Jin Tang? This is a in tonifier and treat coughing, just like Mai Wei Diwan Wan. What is Mai Wei Diwan Wan? Liu Wei Diwan Wan with Mai Mendong and Wu Ji. Very similar, but Bai He Gu Jin Tang treat blood streak of coughing. So this is similar to Qinghao Bijie Tang. So it treats wasting disease like tuberculosis. So latent, unhealed fever. with sticky phlegm. That is Baihe Gujin Tang. Gujin, what does that mean? Gujin is long, metal. Jin means metal. So it treats metal, long. So coughing. And Baihe is internal fire too. So you can use My Way Diwangwan instead of Baihe Gujin Tang, so interchangeably used, but Baihe Gujin Tang for examination, remember this blood streak. Phlegm, sputum. Okay, we just finished all these intonifiers. Intonifiers. And Shishenan, we talked about this when we studied this Li Zhongwan. Right? Do you remember Li Zhongwan? Li Zhongwan. Right? 3 different formulas treat diarrhea. Li Zhongwan, tie-in diarrhea, spleen yang deficiency. Shanling Baijusan, spleen kidney and dampness. Shishenan, kidney deficiency, daybreak diarrhea. So we finished all these formulas. Qi tonifier, blood tonifier, qi and blood. Yin tonifier and yang tonifier is all about Yue Diwangwan. These are all Yue Diwangwans. And we have stabilize and bind formulas, and let's finish today's lecture here with 4 formulas. Intestine Shishenwan for daybreak diarrhea, and essence, this is same semen, and Gujingwan. Gujingwan. And we have 2 different Gujingwan. Gujingwan and Gujingwan. And we commonly say Jinso Gujingwan, just Gujingwan. And Wan Dai Tang, we talked about this when we talk about Longdan Shegan Tang. So Wan Dai Tang treat the vaginal discharge, but white. And let's see. Shishenwan, here, severe yang deficiency. Jinso Gujingwan. Jing is essence. Jinso means golden lock. So essence, but is this one only treat branch. Jinso Gujingwan treat branch. And you know what? This is a very widely used formula, regardless of pattern, as long as patient has the seminal emission, low sexual libido. So modification is important. So if the question asks you, symptoms get better, but he has severe low back pain and low sexual libido, then how can you modify it? Then answer like this: add Shenchi-wan, or add Liu Wei Diwangwan, or combine with Liu Wei Diwangwan. And actually that is a very common strategy in actual practice. Gujingwan with Shenchi-wan or Liu Wei Diwangwan. So modification is important. And Yishu Chechenchi, that is commonly combined, especially when the patient has prostate problems, urinary problems. And Guqingwan is for mens. So this is for essence. So all these formulas are binding, right? Binding. Bind what? Shishenwan, diarrhea. Gujingwan, essence. Another Gujingwan, mens. Wan Dai Tang, discharge. So memorize this. Shishenwan. Shishen diarrhea. Gujing essence, Gujing mens. Male version, female version. Wan Dai Tang, discharge. Because D, connect D and discharge. Wan Dai, discharge. Jing and Jing, essence and mens. And Gujingwan, treat only branch. And Gujingwan here, mens, treat heat. All those formulas like Guji Fulingan, Wenjing Tang, Xiaofo Zhuyu Tang, they all warms uterus, and this is the only formula cools the blood to treat banglo, the bleeding. This is Guqingwan. So it treats heat condition. So heavy, banglo, or early, not delayed. It treats wiry pulse. It has shangfu, and shangfu is a strong herb as a qi regulator. Also remove the pain, treat the pain by qi stagnation. So wiry pulse because it has shangfu inside. And Wenqin Tang is for banglo, same, but this is for cold. But Wenqin Tang also treat the heat too, fever too. But compare these two, because they all treat banglo, the bleeding gynecological condition. Okay, these 4 stabilize and binding formulas.